So I want to just say that the GHAI's Data for Health system, which is part of the Bloomberg Initiative on Data for Health, has been doing this legal review in countries since 2017. And we have created this legal review toolkit, which has been used in over 30 countries. We have a global and HQ team of lawyers, which is all here online and in this room. And what we're doing with these two new tools is taking this to the next level. We know that strong CRVS systems do not emerge by accident. They are built through deliberate policy choices, thoughtful legislative design, and sustained coordination between institutions. So the legal review that was really developed, and I see so many people here, who've been part of that process of development and honing in that legal review. We actually, used, a paper toolkit. And over the last 3 years, our team really wanted to make sure that this online review system was accessible to a much wider group of people, not just lawyers, but government officials, civil society, multilateral partners. And today we will be launching an e-learning toolkit, which is a self-directed toolkit in order that everybody everywhere can access the legal review. The other piece, which is also really a part of sort of our wheelhouse, is we have conducted reviews in over 30 countries, which has resulted in the passage of 7 laws. So what we are trying to also launch today is a CRVS database of laws, where you will be able to access both individual country laws, but also compare across laws and understand how a country's law compares globally to best practice. So all of these resources, I think the idea is to be able to share them much more widely and to bring in a much wider audience to engage on CRVS and to be able to apply it to multiple disciplines and to take it outside our bubble. So I'm really excited that so many new people are here. Both of these, I wanted to just. So we have reached the 100 mark. It's kind of exciting because I also wanted to say that there's a lot of different government partners and CSOs that we work with, as well as data for health partners. We're up to how many? Like maybe 17 partners now globally, and I think we were so gratified that all of them did register to be part of this event. And I want to just say that the legal work that we are doing with Data for Health is also linked to the work that we're doing across this organization. So at this point, I want to say it is my great honor and privilege to invite our President and CEO, Yolanda Richardson, to deliver opening remarks.
Well, good morning, everybody. It's so nice to be here, and so nice to be here to celebrate the launch of these two really important tools for the world and for the Data for Health initiative. I'm President and CEO of the Campaign for Tobacco-Free Kids and the Global Health Advocacy Incubator, and I'm really delighted to be able to come here because this is so foundational for me. I grew up in the Deep South in the United States. Right in the heart of the civil rights movement. I always used to think, oh my God, I missed my opportunity to be on the front line as civil rights were being changed in this country. But for me, and in response to that, I thought, I'm going to grow up and I'm going to be a lawyer, I'm going to be a civil rights lawyer, and I'm going to do my role and do my part. That did not end up being my professional trajectory, but I think today really is a culmination of my own personal sort of life journey, which is that I am able to combine my work and desire to make a difference in the world, to make an equitable difference in the world through law, but also through public policy. So today is really gratifying for me personally, and it's also gratifying for me to be with my colleagues who I've watched to develop and expand this program to reach more and more people. I think what Vandana said was really so instructive to why we're here today, because foundationally for me is access to information, as we all know, is power. We know in this very highly charged time we're in right now that there's tons of misinformation, and decisions in politics are shaped by misinformation as much as by information. So what this program do is really grounds, particularly for the public health space, the best science that we have to make the best possible decisions. And you cannot know how fundamentally that is important for the field of public health. But even more importantly than for the field of public health, it is critically important for marginalized communities who are often unseen, who are often unrecorded, whose lives don't get translated into data. And therefore, the services that we all try to put together and make sure happen don't come to their communities. They aren't considered when population level policies are decided, and they aren't even considered when population level implementation takes place. So we here today in this room get to be a part of a global civil rights movement. Congratulations to us all. I want to just say that, you know, as my colleagues were helping me think through how to really talk about this moment, there are a couple of vital statistics that I just need to be mentioned. We know that 40% of deaths go unregistered. We know that 25% of children under 5 are not included, their births are not demarcated. We know that women in particularly are underrepresented in data. And we know that in 1 in 4 countries, inadequate stillbirth data exist. So you can't have that level of data that does not include critical people, does not include the lives of people who don't often who often are missed. I had the pleasure of traveling with Vandana in India to go to Rajasthan to work on a CRVS law there, and that recognized the trans community. And we went back a year or so later to meet that community. And the data is only part of the story. The personal stories and the lives that were impacted by the trans people who met with me that day and talk about how just being seen was so critical to them, so critical to their identity, so critical to how they see themselves in a community that doesn't often see them. So I can't be more delighted to be here and to also have the opportunity to welcome all of you and a critical partner who we've been working with in Colombia. And I just want to recognize Sebastian Leon Dorado, who has been working in Colombia to help make sure that vital statistics, again, related to the trans population, is a part of the national landscape of laws. So as a lawyer, as a human rights activist, as the president of this organization committed to equity in everything that we do, I couldn't be more delighted to be here. I could be no more delighted to join my colleagues in saying we're happy to be able to put this resource together so that the world can be a healthier, more equitable place for us all to live. Thank you.
Thank you, Yolanda, for always supporting us to push the boundaries and for all of our work on equity. So now it is my honor and privilege to introduce Adrian Pizzatella from Bloomberg Philanthropies, without which this initiative would not have been possible. I've had the privilege of traveling extensively in Bangladesh with Adrian. And, you know, I was just recalling to Adrian that, you know, it's really in sort of the most marginalized communities that you see the critical role that CRVS, and I was on the Bangladesh-Myanmar border where, you know, you have large migrant communities where I had gone to visit, where obviously most of them do not have a birth certificate or any, you know, really something that gives them rights to, you know, basic services. So with that, I want to invite Adrian over.
Thank you. Good morning, everyone. It's great to join everyone this morning. I think we're finally turning the corner in DC to spring, I'm hoping. So you guys came at a great time for those of you who are joining from out of town. Like Vandana said, I'm Adrian Pizzatella. I'm on the public health team at Bloomberg Philanthropies, supporting the Data for Health initiative, which this work kind of falls under. As many of you know, we launched the Data for Health initiative in 2015. As Vandana talked about, the goal was to improve public health data and specifically the use of that data for decision making. We had a very specific focus on the civil registration and vital statistics system, specifically around death and cause of death information, because that's really critical in setting policies, understanding what's impacting your population the most. We currently partner with 25 low middle income countries and provide additional support and resources through our global grants program. But as Vandana also mentioned, you know, we launched the initiative in 2015, but this component didn't develop until a few years later, when we started to see this need for legal infrastructure to underpin all of the activities that were being supported in country. Many countries that we worked in had very outdated or insufficient CRVS related laws. In fact, a lot of them had laws dating back to colonial periods, so they just didn't provide any sort of comprehensive or sufficient legal pinning for most of their population. So the legal review has just become a really foundational part of this work, and we're really excited to support the launch of this resource. The evolution of this work has just made it clear that there's an appetite globally for this sort of legal resource, and that countries really want to develop laws that are best practice to improve equal access, as Yolanda mentioned, and that are comprehensive, and this really fills a really important gap. And this resource really goes beyond what we do in Data for Health, which is really exciting. You know, as I mentioned, we've kind of focused solely on the death registration piece, but this kind of touches on the whole life course events that are included in the CRVS systems, from adoption, marriage, divorce, all these other critical pieces that are part of vital statistics. So we really hope this resource provides inspiration and helps build capacity in countries that want to tackle their CRVS laws. And again, on behalf of Bloomberg Philanthropies, we're really proud to partner with Global Health Advocacy Incubator in launching this resource. So congratulations to everyone who made this happen.
Thank you so much.